Hi there, I'm Dr. Tingle. I see we have you in for a cranial nerve examination today. Is that correct? Great. So, can you just confirm your name and date of birth for me, please? Good. Thank you. So, the cranial nerve exam is the examination of the nerves that control your facial nerves, your ocular nerves, your sense of smell, your sense of taste, as well as your auditory nerve, and the muscles that control your neck and your shoulders. So today we will be doing a very thorough examination of all of those. And during this exam, I will have to be touching you on different parts of your face, head, neck, and shoulders, as well as getting very close to inspect your eyes and your ears. Is that okay with you? Great. So to begin, we are going to start with your sense of smell. Have you had any changes in your sense of smell lately? No. Very good. And have you noticed any additional scents that others around you cannot smell, or have there been any scents that others around you can smell but you cannot? Okay, good. So for the first test, to check your sense of smell, I'm just going to ask you to occlude one nostril and then inhale like this. Okay, and inhale. Good. And now occlude the other one and inhale. Good. So both nostrils are patent, which is good, meaning that there is no blockage, which means that you should be able to smell our test sense without issue. So I have a small vial here, and I'm going to ask you to close your eyes, please, and occlude one nostril, and take a smell of that. Good. You can open your eyes for a moment. Grab the other bottle here, and you can close your eyes. Now please occlude the other nostril. And take a smell. Good. When you smell coffee, very good. Very good. Alright, and one more time. Just go back and occlude your nostril and take a smell. Good. When you smell pine, very good. You can go ahead and open your eyes. And just going to mark on your chart here that your sense of smell is perfectly intact. Very good. Great. So now we are going to move on to your ocular nerve, which is your eyesight. Alright. Have you had any troubles with your eyes lately? Any sense of double vision, blurriness, having trouble focusing, seeing things up close or far away? No. And this should be quite easy. So to begin, we are just going to do a basic examination of your eyes and see how they react to light. So if you would just look straight at me for a moment, don't pay attention to the light. It's going to be very bright. Good. Good. Don't pay attention to the light, just look straight ahead. Straight ahead. Good. Wonderful. Go ahead and blink your eyes a few seconds for me while I make a note. All right, and now we are going to move on to checking out your vision. So we have a very simple Snellen chart here, and I'd like you to just read the letter I point to, okay? So just start here. Good. And this one. Good. This one. Good. And this one. Very good. Put over here. Good. And over here. Good. All the way down here. Good. This one. Very good. This one. Good. This one. Good. And how about that one? Very good. Absolutely wonderful. You are a wonderful patient. All right, so Snellen chart. Perfect. So now we are going to begin a little bit of a deeper examination of your eyes. So the first thing I'm going to do is I'm going to take my Otoscope here, and I'm just going to sit back, and I'm going to just have you look straight at me, and I'm just going to observe your eye from afar. Good. Just keep looking straight at me. Straight at me. Good. Alright, and on the other side, same thing. Look straight at me. Good. Straight at me. Alright, very good. Good. Okay, and now I'm going to come very, very close, and I'm going to look inside your eye. So I'm just going to hold your eye open very gently and take a look inside. So I'm going to lean forward and just open that gently and take a look inside. Just taking a look at the ocular nerve, looking for any signs of copper wiring, damage to the lens and the cornea. Good. Just look up for me real quick, okay? Okay, good. Good. Beautiful. And same thing on the other side. Just going to lean in real close and just open up that eye and take a look inside. Take a look inside. Good. Same thing. Just looking for any damage to the lens. But the ocular nerve looks good. No sign of copper wiring. So very good. Just look up for me, please. Good. Wonderful. No signs of any problems there. Okay, so now we're going to do a little bit of a light response test. So what I'm going to do first is just run my light in front of your eyes like this. Good. And I'm going to hold my hand up like this, right between your eyes. Just going to bring it in real quick. Look. Good. On the other side. Good. Wonderful. And we're going to put that light away for now and use one that's a little bit gentler. So I want you to look straight ahead, and I'm just going to run my light across your field of vision. Good. Just looking how your eyes respond to the light. Just checking how they respond to the light. Good. Good. Now we're going to check for your pupil dilation. So this is the swinging light test. I'm going to use this ocular occluder and cover one of your eyes like so. And I'm just going to swing the light in and out, looking to see how your pupil dilates, okay? Alright, so we're just going to hold that up, and we're going to swing the light in and out, and in, and out, and in, out, in, out, in, and out. Very good. And on the other side, here we go. In, out, in, out, in, out, in, out, in, out. Wonderful. Absolutely perfect. Just going to mark that on your chart. Light response, pupil dilation. Absolutely perfect. Now we are going to look for your blind spot. So what I'm going to have you do is I'm going to have you cover the opposite eye of mine, and I'm going to just have you tell me when you can see the very tip of the pen light here come into your field of vision. So, good. 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 And let's cover the other eye. You cover the opposite of me. Good. 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 Wonderful. Your blind spots are where they should be. Great. All right. And now we are going to do a little bit of a follow the light. So I want you to keep your head straight, and I want you with both eyes to follow the light. Good. Just follow that light for me. Good job. Good. Okay, now keep following. Good. 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 Now close one eye and keep following the light. Good. Good. And close the other eye. And again, follow the light. Good. Wonderful. Well, I have to say that your eyes are absolutely perfect. Just make a note. Great. Now I'd like to move on to your auditory nerve, your ears. So we're going to begin with a very gentle physical examination of your ears, just to make sure that there is nothing outwardly wrong, like any kind of contusion, any kind of cut, any bleeding, anything that I see that could be a cause of concern. So you can just relax. If you like, you can close your eyes. And I'm just going to come over here and inspect your ear very gently. Very gently. Just going to palpate the lobe. And let's check the auricle here. Good. Good. Everything looks good here. Wonderful. And we're going to check the other ear. Same thing. We're going to check the lobe. We're just going to palpate gently. Palpate gently. Palpate gently. Good. Check the auricle. Alright. Good. Now we're going to take a look inside. I'm going to take my otoscope here, and we're just going to gently come over, slip the otoscope inside, and take a look. And taking a look at the tympanic membrane, and that looks like it's pearly white, which is what we're looking for. I'm not seeing any signs of distress or any signs of swelling. No signs of excess earwax, nor any kind of impaction, which is great. Ears look very healthy. Alright, and on this side, we're going to just slip the otoscope in gently. And again, looking at the tympanic membrane, which is, again, a pearly white over here, which is good. No excess wax buildup, which is even better, and no signs of impaction or irritation. Well, those might be some of the cleanest ears I've ever seen. And that is a big compliment, as I see multiple pairs daily. Alright, so ears are clean, no outward signs of distress or damage. So we are now going to do a few hearing tests on you. These are very simple and very relaxing. So the first thing we're going to do is a tuning fork test. So all I'm going to ask you to do is close your eyes. I'm going to ring the tuning fork, and you let me know if you can hear it in the middle, in the left, or in the right, okay? Alright, so here we go. Left, good. Right, good. Middle, good. And you can open your eyes. Okay. So now we're going to do another hearing test on you, where you are going to close your eyes for me. I am going to make a distraction noise in one ear, and then another noise in another. So you let me know if you can hear the noise that is not the distraction noise, okay? Alright, so close those eyes. And here we go. Can you hear it? Good. Alright, same thing. Good. Alright, so keep those eyes closed. And like the last test, I'm going to whisper a word in your ear while making a distraction sound, and you repeat it back to me. Relax. Sleep. Good. Dream. Good. Coconut. Good. Alright, you can go ahead and open your eyes. It's going to make a note. You might be one of the healthiest patients I've ever had. But I think those ears are in perfect condition. Okay. So, now I'd like to move on to assessing your muscles in your neck, your shoulders, and your face, as well as your facial nerve and your vagus nerve and your sense of touch. Alright, so we are going to do a very, very quick, simple test for your vagus nerve. I'm just going to ask you to cough for me while I observe. So, 1, 2, 3, cough. Good. Let's do that one more time. 1, 2, 3, cough. Good. Okay, so have you had any issues with your sense of taste lately? Good. We don't normally do practical tests unless there is actually an outward reason to. So we are going to do a test of your muscles. So I want you to just shrug your shoulders for me like that. So just shrug them up Good. Shrug them up one more time. Good. Now I want you to shrug your shoulders, and I'm going to try to push them down. Don't let me push them down, okay? Alright, so here we go. Ready? 1, 2, 3. Don't let me push them down. Don't let me push them down. Don't let me push them down. Good. And one more time. 1, 2, 3. Don't let me push. Don't let me push. Don't let me push. Good. Very good. Now we're going to do the same thing with your face. I'm going to take my hand, press it to the side of your face, and I want you to push against it while I try to push your face to one side or the other, okay? Alright, so here we go. And don't let me push. Don't let me push. Good. Don't let me push. Good. The other way. Don't let me push. Good. Don't let me push. Good. Don't let me push. Very good. Alright, so that's good. Shoulders good. Face good. Alright, so when we check out the rest of that face of yours, I want you to go ahead and give me a big old frown. Good. Can you lift your eyebrows up like that? Wrinkle that forehead. Good. Go ahead and puff out those cheeks for me. Go ahead. Good. Good, good, good. Now I'm going to place my hands on your neck, and I want you to just swallow for me. Good. And now I'm going to feel down around your jaw, and I'm just feeling your joint here and your lymph nodes, looking for any outward signs of problems. And now I'm going to have my fingers right back here behind your jawbone, and I want you to clench real hard for me. Go ahead. Clench. Good. Release. Good. And clench again. Good. And release. Good. Wonderful. Alright. So now I'm just going to do a little facial exam on you. I'm going to palpate on your eyes. Right on the sinuses. Does that feel the same on each side? Good. I'm going to palpate along your eyebrows here. Good. And does that feel the same on each side? Good. And when I run my fingers down your nose, does that feel the same on each side? Good. I'm going to palpate your temples. You let me know if it feels the same. And palpate. Good. Palpate. Good. Palpate. Good. Palpate. Good. Absolutely brilliant. So, facial nerve is intact. Good. Good. Clench is good. Alright, so while we're taking a look at your face, I'd like you to just open up your mouth for me and say, ah. We're not going to go in there with a tongue depressor. Just going to take a look inside, make sure everything looks good. Good, not seeing any signs of strep or any kind of injury inside the mouth, which is good. Can you lift your tongue up to the roof of your mouth for me? Good, and to the left, and to the right. Good. Alright, wonderful. Well, we just have a few more tests to run on you, and they are the sensory test. So we are going to do a few different ones to make sure that you can feel everything and that your sensory nerves are completely intact. So to start, we are going to do a little eyelid reflex. So what I'm going to do is I'm going to take a cotton bud and I'm just going to twist the end to get a little wisp. just like that, and I'm going to gently brush it on the corner of your eye. Just looking for the reaction, but you're not going to see where it comes from. Brush, good, 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 good. We're going to do the other side, You're not going to see where it comes from. Good, and that's it. Eyelid reflex test done. We're going to do a quick jaw jerk test. I'm just going to place my thumb right here and give it a very, very light tap with my reflex hammer, just to make sure we're not seeing a very active reflex, which could be a sign of something worse. So just hold still, look straight, and beautiful. No problems there. Alright, so for the final portion of this exam today, we are going to be doing the final sensory exam, where you will be having your eyes closed, and I will be touching you with either a soft object or a dull object, and you're going to let me know which one you can feel, okay? So you have a baseline. This is the soft object here. And this very dull acupressure tool is the dull object there. Alright, so you can close your eyes and touch. Soft, very good. Touch. Dull. Touch. Dull. Touch. Soft, good. Soft again, touch, dull, touch, dull. I apologize, that was soft, I apologize. Touch, soft, good, touch, dull, touch, dull. Very good. And you can open your eyes and blink a few times. And we are going to do that again with another dull object and a brush for soft, okay? So you can close your eyes and touch, dull, touch, soft, touch, dull, touch, soft. Soft again, good. Dull. Soft. Touch. Dull. Touch. Soft. Touch. Dull. Touch. Soft. Touch. Soft. Very good. Alright, well, you can open your eyes. Just gonna make my final notes and observations here. But I have to say that you are absolutely, perfectly, 100% healthy. The cranial nerve exam showed no problems with your cognitive ability or neural function. So you can go home and rest easy knowing that you are absolutely okay. But if you need anything else, please feel free at any time to call and make an appointment. But for now, go home, rest, relax, don't forget to hydrate, and get a great night's sleep tonight. And we'll see you again soon. Bye-bye.